Hello, Dr. Rebecca Gee. As you know, my name is Tanya Phillips, and I'm a Public Health Program Manager in the state of Louisiana. Part of my role is to discuss with you priority health issues, what's contributing to those priority health issues, and help develop prevention and intervention strategies to improve the health of our communities. Today, I want to discuss with you the high rate of preterm births occurring in Louisiana, contributing factors to preterm births, and prevention measures our state can take. In the end, we want to create an environment that allows women to have healthy reproductive and sexual health lives, ultimately leading to an improved birthing outcomes. As many of us know, the March of Dimes gave the state of Louisiana an F for our preterm birth rate, which is at 12.3%. To start off, let's set the scene with our problem statement. Maternal-child health problems are a major cause of preterm delivery in Louisiana, especially among women of color. We know this is being influenced by poverty, lack of access to health care, teen pregnancy, and other risky behaviors. Let's briefly go over some data that helps complete this problem statement. First of all, Louisiana ranks 50th in the nation for the percentage of women who fell below the poverty line in 2016. We also know that women and children are more likely to experience poverty than males. Nationally, we have seen preterm birth rates drop, and part of this is due to the decline in teen and young women pregnancy rates. But in Louisiana, we have not seen this rate drop. Louisiana is ranked 44th in the nation for teen pregnancy. To highlight further race and ethnic disparities, most preterm births occur among Black women in Louisiana. We also know that the sooner women can access prenatal care in their pregnancy, the better outcomes there are for mother and baby. But 26.8% of women did not have health insurance prior to pregnancy. Another risk is preterm cesareans being performed. Louisiana ranks second in the nation for babies being born via cesarean. And tobacco use has been known to impact the fetus, resulting in preterm births and low birth weights. And 26.2% of women smoked tobacco 3 months prior to their pregnancy. Now let's look at some of these factors from a social ecological model perspective. At an individual level, we know what a hindrance is, that the lack of knowledge regarding teen pregnancy prevention through the lack of comprehensive sexual health education and how to access preventative health care for youth. So what will help is to help us increase knowledge, especially with our youth, targeting our youth about how to prevent unwanted pregnancy, where to access perinatal and prenatal care. From an interpersonal level, an hinder is youth not having an adult, a safe adult that they can talk to about healthy relationships, sex, and reproductive health. What can help us is by creating an environment of safe adults, parents, mentors, and teachers that youth can talk to about healthy relationships, sex, and reproductive health. From an organizational level, a hinder for us is medical establishments allowing pregnancies to be induced prior to 39 weeks. What will help is the implementation of policies at the organizational level that will limit preterm cesareans or even inducing prior to 39 weeks, especially when it's not medically necessary. From a community level, our community, there is support for tobacco use, especially in public places and bars. And a hindrance is that this tobacco use and tobacco use and alcohol use are part of our culture. It's part of that party state, that Mardi Gras. What will help us is for our community partners and coalitions to advocate for more restrictions on tobacco, such as prohibiting the use of tobacco in bars and possibly also raising the purchasing age to 21. From a policy level, we know that women who experience poverty are less likely to have health insurance. Not having health insurance decreases the likelihood women are accessing preventative care before pregnancy and also during the prenatal stages. What will help is, one, Louisiana, yes, we are expanding Medicaid under the ACA, but expanding Medicaid, it's going to allow for more women to have health insurance and access health care for perinatal and prenatal care, but also allow for providing interventions to risky health behaviors such as tobacco use and drug use. Our proposed interventions is the adoption of comprehensive sexual health education, having this be required to be taught in schools in Louisiana. So we're going to need to work with our legislative bodies to require this comprehensive sexual health education. We're going to want to train teachers to implement comprehensive sexual health education, but also provide local health departments and other community partners to fill in gaps when schools don't have the ability to provide sexual health education. And another important component will be able for us to provide parent curriculum on sexual health education and teach them skills and build their efficacy to talk to youth about sex. We want to increase Medicaid coverage for low-income women prior to becoming pregnant. Let's do this by setting up health insurance sites to remove those barriers and build women's efficacy for applying for health insurance. We know this is a barrier. Let's put on social media campaigns to increase the knowledge about how to sign up and that they can sign up. And let's increase women's wellness exams so that they're accessing preventative care. Let's try and remove those barriers together as leaders, solve those problems. And not only that, let's put on social media campaigns. We know we access social media, and let's show them where they can. But let's also equip agencies that serve this priority population to refer women to medical homes, again, accessing wellness exams. Our proposed evaluations, is to reduce teen pregnancy rate, ages 15 to 19, by 16%, again, aligning with Healthy People 2020 goals. Let's increase the insurance coverage, Medicaid health insurance through the ACA expansion, before they become pregnant by 44%. And let's increase women wellness exams. And we can measure this through the healthcare insurance and referral rate. And all of this will then, we will know we're successful when we decrease the preterm delivery rates. And our goal is for that to be at 9.4%, which is in alignment with the Healthy People 2020 goal. Potential challenges and barriers. They're there, yes, but we can overcome them. Funding is going to be an obstacle. We know at the federal level with current administration that comprehensive sexual health education, the funding for it is being considered, and we know that they're not for comprehensive sexual health education. But let's look at state funding. Do we have state funding to help local agencies provide comprehensive sexual health education, and also other funding to implement that? But can we start requiring schools legislatively to teach comprehensive sexual health education? And that could reduce the funding needed to provide comprehensive sexual health education. From a political and religious view, yes, this is a barrier in our state as well. But we as leaders need to be consistent in providing that education to other leaders, the science behind that. But let's also show how these interventions are cost effective, how it's saving our state funding, how we're keeping youth in school longer, that they're more productive citizens as well. And let's build funding in a legislative bill so that we can accomplish some of these tasks. We often forget that fundamental need there. And then medical provider, the capacity and the reimbursement rates are an issue. But let's review how to support medical providers, how to build capacity, and is it time to review the reimbursement rates, and do we have flexibility to do that? Let's review that and let's make those changes. What you have in front of you, I gave everyone a copy, is just the logic model that we've put together for the program planning and evaluation of these different interventions. So we've listed the inputs. Most of it, yes, is around funding so that we can have staff to implement these activities, that agencies have funding to hire staff to implement these activities, but also for the education. We've listed the outputs, we've talked about the outcomes, and again, our goal is that we want to decrease the rate of preterm births to 9.4%. in the state of Louisiana, again, aligning with those Healthy People 2020 goals. And I just want to thank you for your time. If you have questions, definitely appreciate them. Again, thank you.